Elite Foot and Ankle Associates has 6 locations in the Portland metro area, and they treat everything below the knee with a variety of different treatment options, including red light therapy, which we hear a lot about. With me now is Dr. Trevor Haynes to tell us more about it. Good morning.
Morning.
Okay, so red light therapy falls under the regenerative medicine umbrella. So tell us what that means.
Yeah, so regenerative medicine is just the area of medicine where we're actually trying to heal, like use your own body's cell processes, its own healing mechanism to heal something versus, when you talk about people here, steroid injections, which really with a steroid injection, you're just trying to reduce inflammation. But when you get into regenerative medicine, you're actually stimulating the body's own healing response.
Okay, got it. So who is a good candidate for regenerative treatments?
Yeah, the great thing is everybody is basically. Yeah, there's not really a whole lot of contraindications or people that it wouldn't work for. There's not really a lot of side effects.
Okay, what sort of conditions, though, do you treat with regenerative medicine?
Yeah, so any sort of tendinitis, any sort of kind of nerve kind of injury, inflammation, you can even treat fractures. I mean, you can really treat just about anything with regenerative medicine.
Wow, okay. And then something that you have mentioned before, PRP. Tell us what that is.
Yeah, PRP is where we go in, we take some of your own blood, we spin it down, take all those good healing growth factors and platelets, and then we re-inject it back into the area that's problematic. So say you've got a partially torn Achilles tendon or a plantar fasciitis, we're re-injecting that in order, again, to promote healing versus just getting rid of inflammation with a steroid.
Okay, and then another regenerative medicine technique, red light therapy, I understand. Tell us what that is and how it fits into all this.
Yeah, red light therapy we would do in conjunction with things like PRP or other regenerative medicine techniques. Basically, it's taking photobiomodulation or red light and upregulating your body's cell signaling and reducing inflammation, improving blood flow, and promoting healing. So it kind of brings all that together and just incorporates it together.
Okay, you kind of mentioned like a steroid shot. I know cortisone shots are very popular. So tell us again how these are different than maybe a cortisone shot, for example.
Yeah, so cortisone is steroid. It's just another word for steroid. And what those do is that we use them a lot mostly for ligament injuries, joint injuries, osteoarthritis, and we're trying to just reduce inflammation. A steroid is an anti-inflammatory, so we're trying to get rid of the pain. We're not doing anything to heal. We're not doing anything to help make that area better. We're just trying to get rid of pain. Regenerative medicine, we're actually trying to promote healing. So not only are we trying to reduce pain, we're also trying to help. I mean, we can't fix arthritis completely, but we're trying to help heal the problem.
Sure, got it. What kind of results can patients expect with regenerative medicine?
So it's just like anything else. No, nothing's perfect. But with a lot of regenerative medicine therapy, especially like when we use laser, red light, a lot of patients are seeing sometimes 80% satisfaction. Of course, that's according to the patient and what their pain threshold is, what they feel is like working versus not working, but usually about 80% satisfaction.
That's great. How does insurance fit into all this? Will it cover regenerative therapy?
It does not, unfortunately, which is the hard part, right? Insurance, as we know, it'll cover steroids, but steroids we talked about, they're good at reducing inflammation, but they're also detrimental to the surrounding tissues. We don't get that with this. So it's, lack of a better word, kind of pick your poison, right?
Yeah.
Do you want to just get rid of pain, or do you want to pay a little extra and actually try to fix the problem? For
sure. Tell us what else Elite Foot and Ankle treats, what other things you do in your offices.
Yeah, we treat anything from the knee down. So anything related to the foot, to the ankle, whether that's fractures, tendinitis, sprains, strains, nail fungus. I mean, we treat anything that's related to the foot.
Okay, how can people learn more information, find all your locations?
Yeah, they can go on our website at elitefaor.com. Or they can give us a call at 503-668-5210.
And you have 6 locations all around town, so easy to find.
Correct.
Thank you so much for coming. I always learn so much, so appreciate you being here.
All right, thank you.